Welcome to this video where I'm going to show you how we correct aortic root size for patient body surface area to assess the yearly risk of an aortic complication in our patients. Firstly, we derive the body surface area using height and weight and the Bois calculation. We then assess the aortic root size, the largest dimension in the root or the ascending aorta, on contrast CT. And we can then calculate this based upon the nomogram provided to us and referenced at the bottom of this video. So here is a body surface area, aortic size nomogram. There's referenced very nicely in a paper in the Journal of Thoracic and Cardiovascular Surgery, 2018, by Zafar and co-authors. Along this axis we see body surface area, which is a complex calculation that involves measuring the patient's height and weight and putting it into an equation. That equation is described at the bottom of this video if you want to go to a link to calculate body surface area. Along the top we've got aortic size measured on a contrast CT scan. Perpendicular slices must be made to ensure that this dimension is accurately measured. So if we were to do a calculation, say we have a patient with a height of 180 centimeters, a weight of 80 kilograms, we get a body surface area of 2 based upon the Bois calculation. At 2, these are the yearly risks of an aortic complication. We have low risk in green, moderate risk in yellow, in light brown we have high risk, and in red we have severe risk. So for this particular patient with a body surface area of 2, we see that for an aortic dimension of 4.5 to 5.5, we have moderate risk of yearly aortic complication and high risk at 6 centimeters. Now, body surface area is a very complicated equation, can be difficult to calculate, and Zafar and co-authors very nicely demonstrated that a height nomogram alone can be quite accurate. So let's test it. At 180, we can see that moderate risk is 4.5 to 5.5, and high risk is at 6. So not a bad calculation of risk based upon height alone. Now, if you're a patient using this nomogram, please remember there are so many features that go into this calculation, and the calculation is really one for doctors to assess. They will look at your risk, they will look at the accuracy of the measurements of your aortic size, and also an accurate calculation of your height and weight to ensure that this risk is appropriate to you. Nevertheless, the video I hope will help you to be able to have the conversations that you need to have with your doctors to better understand when they decide when you need an operation.